A very good morning to one and all. So the topic I'll be covering today is the introduction to dental cements. So let us go into the definition of a dental cement, which is a substance that hardens to act as a base, filler, liner, filling material, or adhesive to bind to devices and processes to tooth structure and to each other. So in this picture, we can see that when we give a filling in a deep cavity, what happens is normally we'll have to reinforce or line the tooth, the missing dentin with a liner, which is a calcium hydroxide, which we can see here, which is followed by a base. So base is generally a material, when you're giving it as a restorative material, it will replace the missing dentin and also protect the underlying pulp, following which, if it is a very small cavity, we will be only going for a varnish. When we look at the lower picture, we can see that this is a typical picture of luting a crown with a cement. So depending upon the type of use of the cement, there is different consistencies which are there. So you might have a loose or a thin mix, which is used for luting. So luting is basically fixing the crown to the prepared tooth using a cement. Generally, we use a class ionomer luting cement, which is known as a type 1 cement, and the excess cement is removed in the lower picture with the help of a probe. So what is another definition given for dental cement is a dental cement may be defined as an inorganic, non-metallic substance that hardens to act as a base, liner, or a restoration, or an adhesive to bind devices or processes to tooth structure. A material that sets from a pasty mixture to a hard mass through a chemical reaction is another definition for dental cement. So when we go on to dental cement, as we all know, there is different types of dental cements. So there is a various classifications that is given. So the classification given by Craig. So Craig has classified it based on their ingredients, which is a water-based cement. The examples are glass ionomer cement, zinc polycarboxylate, and a zinc phosphate cement. Whereas a resin-based cement is a composite and adhesive resin and compoma. And you have an oil-based cement, which is zinc oxide eugenol and non-eugenol zinc oxide cement. So this is a classification given by Craig. Now, when we move on to the next classification, O'Brien has classified cements based on the type of matrix. So you have a phosphate matrix cement, which is zinc phosphate and zinc silicophosphate. When it is a phenolate, it is ZOE, that is zinc oxide eugenol and EBA combination, or a polymer reinforced zinc oxide eugenol cement. Whereas you have a next one, which is a polycarboxylate matrix, which is zinc polycarboxylate. And then the other example is GIC, which is our glass ionomer cement. Then you have the resin, which is a polymethaacrylate and dimethaacrylate. So once again, we looked at Craig's classification and O'Brien's classification. So O'Brien's classification was on matrix, which is phosphate, phenolate, zinc polycarboxylate, and a resin. Now, when we go into the next classification, which is Donovan's classification, he had broadly divided cements into a conventional cement and a contemporary cement. Conventional cement, the examples are zinc phosphate, zinc oxide eugenol, zinc polycarboxylate, glass ionomer cement. Contemporary cements are resin modified GIC and resin cements. Then moving on to the next one, which is general properties of cements. So when we take a cement, we have to have a particular amount of time that allows us to mix it, put it into the cavity, condense it to the shape that we want. So that is defined as a working time. So working time, it is a time that elapses from the start of the mix till the time the material can be handled or placed in the cavity. So generally, we'll need a cement to have a time of about 2 to 5 minutes of working time. Whereas a setting time, this picture is a classic picture on how we will be mixing a zinc oxide eugenol cement or a zinc phosphate cement. You will have a luting consistency or, a restorative consistency, which will be thick and thin. So a setting time is a time that has elapsed from the start of the mixing until the material hardens. So first is the working time and then followed by the setting time. Generally, the setting time is 2.5 to 8 minutes, which is ideal. The next property is a viscosity. So depending upon what is the use of the cement, the thickness or viscosity, that is the measure to flow, will be different. So if it's obviously for a restorative purpose, we will go for a thicker mix. So we'll be having a lesser viscosity. Whereas, more viscosity, it'll be a thick mix, whereas luting consistency will be a thinner mix. So resin-based cements is a type of cement that will come in different types of consistency based on the use that we're going to use for. If it's a packable cement or it is a luting cement, the viscosity will change. Whereas the other types of cement, which is generally a powder and liquid ratio that we can mix manually. So if you obviously take more liquid, it is going to be a thinner mix. Okay. Then we go to something known as a film thickness and consistency. So a film thickness is when you are going to put a cement in between a restoration or a processes and the cavity. There is a minimum thin, like you can only compress the cement to a particular film thickness. So luting cements are seen to exhibit significantly low viscosity when mixed, and in order to flow under pressure and form a very minimal and uniform film with a thickness less than 25 micrometer. On the other hand, consistency of restorative cement should be thick and plastic enough to ease of handling and placement into the cavity. So another point is solubility. So we are doing all this in the cavity. So there's obviously saliva, which is present. So the problem with saliva is that when it comes in contact with these cements, it may lead to its dissolution. So what we would suggest is to use a cement which has less solubility. So in that also we have first seen the classification, right? So water-based cements are seen to be more soluble than an oil-based cement. Powder liquid ratio, if you modify also, you can change the solubility of the cement. So when you go for a lesser powder liquid ratio, solubility is more. When you go for moisture, is more, solubility is more. And the maximum permissible dissolution rates for various cements within the 24 hours after placing it in the cavity can be 0.1 mm for a glass ionomer cement, 0.2 for a zinc phosphate cement, and 0.3 for a zinc polycarboxylate cement. So classically, I would just like to explain how we will be giving different types of restoration, which I had already shown first. So this is various conditions. Now, if you look, it is a cavity that is extending into the outer 1/3 of the dentin. If it is like that, we will be just applying varnish and then giving the cavity. Whereas if we're going to go for a wider cavity, that is, or a deeper cavity that is extending into the inner 2/3 or inner 1/3 of the dentin, we will have to give an RMJIC base. This is depending on the remaining dentine thickness. So when remaining dentine thickness is very less, you have to give a liner followed by a base and only then go for a cavity, for a cavity restoration. So if it is a small cavity, we'll be only giving varnish. If it is deeper, we have to give a base also. And then if it's a liner, if it's very deep, then we'll go for a liner, base, and varnish. Okay. Now, so now we'll be moving. Now, when we move on to the first cement, which is a zinc oxide eugenol cement in detail, we will go into a different variations of the cement is there, which is a zinc oxide base. Periodontal pack is also another use of this cement. So classification of ZOE can be ZOE type 1, which is for temporary cementation, 2 is for permanent cementation, 3 is for temporary filling materials and thermal installation, and 4 is for cavity liners. So composition, obviously you'll have a powder and a liquid. So powder is zinc oxide is there, white rosin is there, zinc stearate, zinc acetate, and magnesium oxide. Whereas in the setting reaction, we can see mainly two steps. That is, you have the eugenolate, which is the water. The liquid that is there in the cement. So zinc oxide will mix with the water first to form zinc hydroxide, which then reacts with the eugenol to form a zinc eugenolate, which is what is found in the set matrix. So what is the different ratios depending upon the different types of use? You can go for a powder liquid ratio that will vary from 4:1 to 6:1. And it is done in a circular motion. So here we can see in this picture, you will have a cement spatula, the powder and the liquid. Then you will dispense it, divide it into equal increments, mix it with the liquid in a circular motion over a large area because zinc oxide eugenol has an exothermic reaction when you mix it. Okay. Then we go on to a setting time, generally is 4 to 10 minutes, and complete setting takes around 12 hours. And there are various methods that we can try to change the setting time. That is, if you have finer particles, it will set faster. Accelerants can also be used. Retarders can also be used. If it's a higher temperature, it will accelerate the setting. And if powder liquid ratio is also different, it will set differently. Then physical properties is zinc oxide eugenol is generally a very weak cement. It has a compressive strength that ranges from 3 to 4 megapascal to 50 to 55 megapascal, depending upon how you use it. Tensile strength is 0.32 to 5.8 and modulus of elasticity is 0.22 to 5.4. So it has an excellent thermal conductivity, and the only problem with this cement is it has a high solubility. That is, it will disintegrate when it is in presence of oral fluid. So biological properties is out of all the cements that is present, it is considered to be the least irritating, and the pH is 6.6 to 8 is a pH once it's set, and pulpal reaction is seen to be mild. They will inhibit the growth of bacteria and have a soothing effect on the pulp and deep cavities, and hence reduces pain. So, like I said, there are some modifications of zinc oxide eugenol, which is a polymer reinforced zinc oxide eugenol, which was an attempt to improve the properties of zinc oxide eugenol. And you have the EB or alumina modified zinc oxide eugenol cement, and non-eugenol cements are also there, which can be used for patients who have allergy to eugenol. So that is all. Thank you so much.